Olá, pessoal! Hoje no Brasil Low Carb Entrevista, eu tenho a honra de estar com um cardiologista que é mundialmente conhecido pelo combate à obesidade e ao excesso de consumo de açúcar. Consultor do Serviço Nacional Inglês de Saúde, coautor de best-seller, o cardiologista Aseem Malhotra.
My name is Dr. Aseem Malhotra. I am a cardiologist and I am also a visiting professor of evidence-based medicine at the Bahiana School of Medicine and Public Health in Salvador.
Okay, so thank you for the information. And when did you decide to be part of a change in the health system?
That's a really good question, Mariana. I think the first thing to say is I've now been a qualified doctor for almost 20 years. I qualified in 2001. And over a number of years as a practicing doctor and then specializing in interventional cardiology, I noticed there was more and more stress and strain on our healthcare system, our National Health Service, with more and more people coming in with obesity-related diseases, type 2 diabetes, for example. And I tried to then try and understand what was going on to get to the bottom or the root cause of the problem. And that really started for me probably 2010. And I remember very well that I treated a patient who had a heart attack in the middle of the night with a stent, emergency angioplasty. So we unblocked his artery. He was in his 50s, he did well. And then the next day I'm having a conversation with him about taking his medication, but also trying to follow a healthy lifestyle, stopping smoking. And when I'm talking about eating a healthy diet, he gets served by the hospital a burger and fries. And he said to me, "Doctor, how do you expect me to change my lifestyle if you're serving me the same crap food that got me here in the first place?" So for me, that was what we call an epiphany moment, a moment of realization that even our hospitals had neglected the importance of healthy diet. And we know that many people who are overweight or obese in this country certainly are also people who work in healthcare, doctors and nurses, because the food environment is very unhealthy. So that's really where it started for me, Mariana. And then I went on a kind of journey to try and investigate, what was the dietary guidelines, what were people being advised, what were the root causes of all this problem. And then once I had that realization and I studied it and researched it and started publishing, then it was about the real issue then is about being an advocate. So to try and spread the truthful message to really help people get healthier and happier. That's what we all want. So one of the things that I learned in that journey is that changes in diet, and there are different ways of doing it, but what seems to be very effective with my patients is certainly when they cut out the carbs, the refined carbs, the sugar, that those markers of health get better very, very quickly.
Okay, perfect. And what can you tell us about the differences in opinion on cholesterol? What you have learned in school and what you know now?
Yeah, that's a very good question. And that's something I look forward to speaking about when I come to Brazil. But yes, the reality is this, Mariana, for 99% of people, total cholesterol, your total cholesterol number isn't very useful or helpful. And what we were taught in medical school is just to understand that high cholesterol is bad and you need to get it as low as possible. But the reality is that isn't true in terms of health benefit. There is very inconsistent evidence that does any benefit. Certainly there's no benefit from changes in diet. And the small benefit you get from statins seems to really only apply to people with heart disease. And even then it's quite small when you tell people the actual benefit for them as an individual. So I think to answer your question, we have grossly exaggerated cholesterol as a risk factor, and it isn't really what we should be primarily focusing on to combat heart disease. But the several decade campaign to lower cholesterol has failed to curb heart disease, and there are good scientific reasons behind that, which I will discuss again in more detail when I come to Florianopolis.
Okay, perfect. And just tell me, a person can be fat and fit?
In theory, yes, but actually the reality is that people who have excess weight, even if they do lots of exercise, that excess weight is still carrying a risk for them, certainly over a longer term period, certainly beyond 10 years. I think to add to that, what I would say as well is that there's no such thing as a healthy weight, only a healthy person, because people who have a normal weight, okay, a normal BMI, who are metabolically unhealthy, are at much greater risk than somebody who is obese and metabolically healthy. So what the point I'm making is that we are all vulnerable to the problems of excess body fat, but that even starts at very low levels, according to a lot of people, of BMI, and it's about the abdominal fat. So the message that I think we need to keep pushing for is that improving diet really is something that would benefit everybody, no matter what your shape and size.
So great. And now that coronavirus has shown a bad outcome, especially in people with a metabolic disease, do you believe that nutrition guidelines might change?
Again, it's a very good question you ask, Mariana. I hope that they do change. I think one of the things that I have discovered in my journey, my investigation, is that the dietary guidelines themselves are not independent. And when I say not independent, they have been influenced by commercial interests, by the food industry, by the very industries that are selling the types of food that are more likely to make you overweight or obese. And I think that's also a big problem that we have, especially the low-fat, high-carbohydrate message has been distorted by such industries. So what we really need is independent, up-to-date dietary guidelines. And in fact, one of the people I think who has done a lot of great work is a Brazilian researcher by the name of Carlos Monteiro, who's based in Sao Paulo. And he has made a very nice, elegant connection between ultra-processed food, which has been well-defined as essentially mass-packaged food that has 5 or more ingredients, usually high in sugar, starch, and unhealthy oils, and weight gain. And I think on a population level, certainly that needs to be reduced. The consumption of that needs to be reduced. But I think that, yes, the dietary guidelines are certainly a root cause, one of the major factors behind obesity and type 2 diabetes, which I know in Brazil is a big problem. The data, up-to-date data suggests that 56% of adults in Brazil are overweight or obese, about 20% are obese. And over the last 35 years, the prevalence of type 2 diabetes in Brazil has increased significantly. In the 1980s, it was about 7.4%, and now it's about 15%. So this is a big problem for Brazil. And I hope that my work and my advocacy and my lecture can certainly have an influence and impact on many people.
Yeah, sure. And how did you start your connection with Brazil?
So that's actually quite a funny story. It came through a patient who came to see me. In fact, a couple came to see me to ask for some advice. I think the chap had some heart issues and wanted some dietary advice. And his wife actually said to me, you're quite well known amongst certain circles in Brazil. And I said, oh, that's surprising. I don't know any Brazilian people. But it was nice to hear. And then I asked her a bit more about it. And in fact, the credit to that, my notoriety or being known in Brazil, I think goes to initially to Jose Souto, who's a very respected urologist and very well-known. I would say he's a very knowledgeable expert on diet and obesity. And he had been writing, I understand, he'd been mentioning my name a few times in his blogs that had become very popular. So that is how the initial contact was made. And then I then got contacted not long after that by a dietitian who again wanted to interview me, who's based over in the UK. And she's quite, I think, quite well known in Brazil. Her name's Raquel Britsky. So we then connected, and then the third thing that happened that keeps my I think that something I'm quite proud of is somebody who I respect a lot, who's a very eminent cardiologist in Brazil called Luis Correia. He had actually, interestingly, we had a contact many years before. In 2015, he came to the UK because I was part of launching a campaign with the medical establishment and the British Medical Journal called Choosing Wisely, to highlight the harms of too much medicine. And Luis has been sort of the leading voice in Brazil on this. And we connected and we formed a good bond. But I then contacted him again when I was invited to come and speak in Sao Paulo by Jose. And that's really how I cemented my friendship with him and spent some time with him, and spoke also in the university, and they offered me a visiting professorship. So when I come back to Brazil in November, I also look forward to doing some, giving some lectures in Bahia as well.
Perfect. And in your opinion, what is the biggest challenge to change the mentality, resistance of the medical community, or to change the eating habits of the general population?
That's wow, which is more challenging? I think they're both equally challenging. I think they're both very important to do, and they're both linked. Because one of the things that one of the reasons that, as you're probably aware, Mariana, is that a lot of people become helped, get helped by low carb, but then the challenge is convincing their friends or even themselves, saying, well, my doctor's saying the opposite. And the reason for that really is this lack of knowledge. For most of the doctors, it's not something we're trained in, nutrition. It's not something a lot of doctors are necessarily that interested in, but they know it's important. And that also needs to be highlighted as a big problem. There was a recent publication here in the UK, in the BMJ Nutrition Journal, that actually highlighted that, majority of doctors, 75% plus, felt they lacked either the knowledge, the confidence, or the time to have conversations about nutrition with patients. But the overwhelming majority, more than 90%, felt that it was a very important issue that needed to be addressed. So there is a will, doctors want to learn. But what they often do is that they will just give the advice based upon the dietary guidelines, which we already know are, flawed at best and harmful at worst. So I think that's one challenge, but that's something, again, I think is important. There are lots of other doctors other than me as well who are pushing for the change within medicine, and lots of other doctors around the world who are doing great work, such as Jose in Brazil. So that's one aspect of it. In terms of the population, I think, again, if we get the guidelines changed, but also then we engage the politicians really to try and make them understand, Mariana, that the advice alone isn't enough, because we know that, a food environment that pushes a lot of ultra-processed food, then it becomes more challenging for people to make the right decisions. So we have to think about how we make the healthy choice, the easy choice, especially for those people in Brazil who come from the more deprived backgrounds. We know there is certainly what we call social inequalities. And that's a big issue too, and that also means that politicians need to accept some responsibility about how they can help those people have a healthier life. And, one of the things I would say that, one of the things we've learned from COVID-19 that some of us were already aware of, but I'm hoping more people are aware of now, is that we're all interconnected. We live in communities. What happens outside our house, what happens down the road, it will somehow come and affect us. And in many ways, people are being misled, and it's an injustice. And there's I'll use a phrase that comes to mind about this whole issue, about really what is an injustice being inflicted on many people for such a long time, where they're not being given honest and transparent information. That seems to be more prevalent in people who come from the poorer backgrounds. They have less access to education. Is that injustice anywhere is a threat to justice everywhere. And actually a quote from Martin Luther King, the black civil rights leader in the United States. So I think we have to just think about that as well, is that when we're trying to help our individuals and our families and our friends, which is very important, and I get a lot of satisfaction from helping many, many people that I see individually, I also personally always think, how can I also do my bit to help the community and help the wider population? Because this problem is so big now that it's affecting healthcare systems around the world.
Yeah, so true. Yeah, we are trying to help all the people too here. Oh, talking about it, what is your best advice for us to improve our health?
What is the best advice? I think food. Food is probably the first thing I would say at the top of the list. We have so many different lifestyle factors that of course are very important. When people talk about the lifestyle medicine, or what does it mean to be happy and healthy, we think of food, we think of exercise, we think of stress, we think of sleep. All of these things combine together and contribute to your sense of well-being and your health. But the one thing to start with that seems to have a bigger impact than anything else, certainly in terms of the speed, is making sure that your diet is right. And then, of course, adding in the other components in the right way. That's what I would say, more than anything else. Food is medicine. We should treat it like medicine. And if we want to fix our healthcare system, everybody must know that we need to fix the food. Every single person needs to know that. The politician, the person working in the coffee shop, the cleaner, the guy that takes the garbage out, the doctor, the patient, everybody needs to know that. As soon as people know that food is medicine, then we will sort this problem out much more quickly.
Perfect. So can you leave us a message, especially for the audience that is going to see you next November?
Well, first of all, I'd like to say that I have a special affinity and connection and love for Brazil and its people. When I came here a few years ago, it was, for me, one of the most interesting, remarkable, and enjoyable experiences that I've ever had. And, I very much look forward to coming back from a personal perspective, but more importantly, to spread the message of truth. People should come with an open mind. Some people may already be converts, but hopefully, they'll learn a lot of new, interesting things, and it'll help empower them, not just for themselves, but I will also give them tools that they can use so they can have a much bigger impact on their community as well.
So thank you very much. It was a pleasure to have you.
Lovely to see you, Mariana. I look forward to it. I'm very much looking forward to this.
Okay, thank you very much.
All the best.